Any questions about today, about what we're going to be going over? Okay, so we're finally moving on a little bit past lower extremity taping, wrapping, and we're getting to some braces. So we'll start out with a little bit of padding on it. So our first one is shin guard padding. Primarily going to see this in soccer, football. Obviously, two primary sports that are either have cleats kicking into you or constantly trying to get feet kicked on you type of thing. So I grabbed a couple various shin guards. So when you think of shin guards, you're typically thinking of like the soccer shin guards. Okay, they're going to be more something like this. This is even a little bit more. I found this down in the football room because BG hoards everything. So this one kind of slips under the shoe. So our nice hard shell that you would normally see for a shin guard. Okay, football, soccer, however it might be, sits on the shin, nice and easy. A couple other options that there are, so like these are just nice neoprene sleeves that have a little bit of extra cushioning padding. Probably seen them more popular, and we'll talk about like elbow pads, especially for basketball, those kind of things. But it's just an extra little padding cushioning. This one's about the same thing, except 20 years older. Once again, guy's a little stretch type of thing, and this one's got a little extra thicker padding. Same thing, would slide them on. So when you're thinking about shin padding, it's not just your typical hard shell padding that you're looking for. But what we're kind of testing out on is also about our custom padding. So you can take this shin guard, and if you need to, you can add extra padding to the inside. So going back to some of the foams that we had showed you last on Tuesday. So we have some of the felts. We have different foams that are maybe pieced together, and we also have like our open cell. Okay. As you can kind of see in the picture, they do have, there might even be on the other one. I think it might be custom one. But no matter what you're trying to fit, if someone's like, oh, I need extra padding up higher, extra padding a little bit lower, go ahead and take your felt foam, whatever, stick it inside. If it's more comfortable, you can do more like our donut pad style and stick it in there, especially if they have some bruising right along that shin. Donut pad's going to be the same thing. So it's going to take the pressure off of wherever that pain is so that the padding around it can absorb it. Okay. So our shin pad padding and our custom padding, basically the same thing. It's whether you're adding it to padding that they already have or your softball player and you're a second baseman and someone shortstop, someone keeps sliding into your leg as you're trying to take them out, you're going to give them some type of custom padding to wherever they constantly keep getting kicked or slid into or whatever the issue might be. Like I said, you can do as much as just a plain piece of foam or felt on the area. If you have one spot, use your donut pad right over top of the area, wrap it on. And so those kind of options, you can either, take your PowerFlex, sheer light, whatever, wrap it on. You can take some of that stretchy compression net like we showed on Tuesday and just slide it up like a sleeve with this underneath of it. Okay, so those are your multiple options to try and just get them on there and stick them on there or keep them in place. The only problem you might get is if it starts sliding up and down. So you want it here. As they get running, as they get moving, it might take a hit. It could start sliding down. Then you want to make sure you have at least a strap of something or half overlapping so that it stays in place. So that as they're running and moving, it's not constantly sliding down. Then they're reaching in the middle of the game, but match practice and trying to slide it up every time. Okay? Or that's why we have shin guards, practice so you hear, strap them on, but you'll see every single soccer player puts their shin guards on, they come asking for a half roll of tape to try and tape their shin guards on. Okay. So that's why anytime I cover soccer, I always make sure I have scrap rolls because I am not giving the soccer players or football players or whoever a full roll of tape to wrap on their shin guard. Okay. And if it's somebody, we kind of talked about this a little before, if it's somebody that refuses to wear shin guards during practice, because soccer it is not required in practice, just required in games, and they constantly get kicked in the shins, they come and complain to you about it, I have no mercy. 100% avoidable. Wear a shin guard. So, right. Design. Okay, patellar tendon strap. So we're talking about patellar tendon. So remember anatomy. We find the patella. The patellar tendon comes and attaches to what? Tibial tuberosity, okay? So it's that nice bony landmark that sticks out. So our tendon travels between that inferior pole and the tibial tuberosity, so we're right inside here. We start having tibial tendonitis. We can have Osgood-Schlatter's disease. That's when it's pulling on our tibial tuberosity. Larsen-Johansson disease. That's where it's pulling off that inferior pole of the patella, okay? Most predominantly in adolescents, because they're either growing too fast, so they're growing so that muscle is not catching up and it's pulling too much on the tendon, or overused athletes, overused jumpers, those kind of things. It could also cause a jumper's knee, okay, when we get that patellar tendonitis going in there. So what we're trying to do is just almost disconnect that pulling. So we're taking our straps, either over-the-counter strap or our homemade type of strap. So I got a couple here, but these are also called toe pat straps. This is the proper name for it. This is a McDavid. McDavid is the brand name for it. As you can see, it's a nice, got a little bit of stretch to it. Has almost like a little bolster in here. Okay, so that bolster is getting applied right over top of that patellar tendon. You're taking your strap and wrapping it around. Okay. Comfort level of the athlete. What's nice about these is you can retighten it throughout the match, practice, whatever it is. So if it feels like it's coming loose or you kind of need to adjust it, you can always unstrap it and strap it back up. Okay. So, and these are not very expensive. You can get these at any, pretty sure Shields has them. You can even get them at Walmart, Walgreens, whatever. So if you're having an athlete with issues, super cheap and reasonable for them to go out and buy it. Homemade toe patch straps is, we just use our pre-wrap. So I want to have you slide this off the table a little bit. Okay, this one, yep. So I want to get them into kind of a relaxed position. You can have them hanging off, so if I was sitting, that'd be fine too. We're going to get a little bit of tension. Sorry, you guys behind me. A little bit of tension with that pre-wrap, okay? So the tighter you pull, the tighter the strap will be, okay? So we're just going to go around about 3 or 4 times, cut her off, and then we're just going to roll it. Always making sure that it's below our patella, but above that tibial tuberosity, okay? What's nice is if you do get it a little bit tight, you can take it, you can stretch it out a little bit to loosen it. But the only way to make it tighter is to rip it off and redo it. I'll use the pre-wrap if I have somebody that's starting to have some tendonitis, but we're not quite sure, and I just want to try it to see if it actually feels good. Because all of a sudden it's done, rip it off, throw it away. So I'm not buying something that we don't know if it's going to work or not. So I usually try that. Some athletes find it more comfortable than having the actual strap on them. The straps are obviously thicker. Sometimes if you don't get on straight, then Velcro could rub and bother you. So it's all kind of preference. If I'm having an athlete that's consistently using pre-wrap, you know, a whole box of scrap rolls down in the training room, let's say grab what you want, take it, and you can do it in the locker room before we even go to practice. So especially if they're finding that they like that or prefer that. Yeah. Okay, so we'll get into our other like true knee braces. First one is Hinged knee brace, and I brought various ones that we have. So this is predominantly, this is one of our nicer ones. Obviously, this is Donjoy. Donjoy, once again, is a brand, so this is known as a hinged brace. It's got that neoprene compression feel. Then we just have the straps to tighten up around the quad and around the calf. Okay, so you can see like in the various ones we have various straps, how it straps, those kind of things. Whenever we're going to slide back again. Whenever we're applying a knee brace, no matter what type of knee brace we have, where do our hinges go? Where are those hinges? The joint line, yes. So we're making sure we're lining up with the joint line. So we are lining them up with our MCL, LCL, but we want to make sure then, so right where that meniscus is and that joint line is where we're actually lining up those hinges, okay? Because it's mimicking where that femur and that tibia come intact. And the hinge itself is acting as a outside MCL or LCL ligament, just extra protection. Okay, so whenever we're lining them up, we're sliding them on, making sure it's fitting properly, that the knee, the hinges are right at the joint line, and making sure we don't have too much gapping around the needle plane at the top or bottom, or that it's too tight that they're unable to actually get up into proper form. Okay, so these are used primarily for various analogous forces. Once again, protecting the MCL, LCL. Primarily now we have a bilateral hinge brace. You can see back in the day, and I think even our picture shows a unilateral hinge brace. What's the point anymore? Why? If you're going to protect it, might as well just protect both sides. Okay. Back when I was in college, we saw that a lot in football, especially our linemen. All of our linemen get knee braces, especially our starting linemen. O-line, D-line, whatever it is. We don't do the hinge braces, we'll do the functional braces, which we'll get into. But before we had the money to buy like our functional braces for all of our linemen, we had unilateral hinge braces that you would literally have to stick on there and tape the top and tape the bottom and hope that they stay. Type of thing. So if they loosen up, you can't restrap them, or if they loosen up, you gotta take the tape off and then you have to rewrap them consistently. Okay. So if you're putting anyone in a hinge brace, might as well just go and get them a dual hinge brace. And that's how we carry anymore too. I don't even know, if I dug around a little more, I'll probably find a unilateral brace in BG's closet, because like I said, he saves everything. So this one we'll talk more about on Tuesday, about our patellofemoral sleeves. This one has patellofemoral, so we have that hole where our patella sits into to help with any tracking issues. You can kind of tell this one's a little padded, and it's padded all the way around. So it kind of helps with multi-directional issues. Like when we talked about our McConnell tape, so say we slide medial or we slide lateral, whatever it might be, having a full circle and padding around the full circle just kind of encases the whole patella to make sure we still get good, good movement with it. Okay. Like I said, I have a couple examples here between hinges, some older, some newer. We'll talk about, I can see this one's obviously a little older, and even come up and weigh the difference. This guy is at least a pound or two heavier. So a lot of our braces, so this probably has actual, I think this one's like true, like metal, hinges on the inside. So we got metal in here, where these guys are more of a higher quality. So a little bit of metal, but it's actually more of a high quality plastic, which in there, which holds up just as well. But it's a lot lighter, so athletes are going to like that a lot more if people run or move around in compared to something super heavy. Okay. So when you're trying on, obviously looking at the different various things we have, when you're trying them on, I try to grab different sizes, but I don't think I got a good variety. And like I said, sizing is different between brands. So I do have a Donjoy up here, like this one's a Breg. One could be a large and it fits like a small on another one. So proper sizing is measuring the circumference of your quad and your calf and lining it up with whatever that brand and their sizing is type thing. So you can see this one's got an actual plastic patellofemoral brace on it to help track it. So this can be moved. I think this only pulls the brace laterally type of thing. Yeah, I don't think you can switch it from side to side. So we'll talk more about those on Tuesday. I wanted to bring them up. Okay, next one is, so derotation brace. I want to make sure which this one looks like.
It's the functional.
It's a functional, okay. So it's called a derotation brace, but it is never called, it's not a derotation brace. It's a functional knee brace. Most of you will recognize it. Some people even call it an ACL brace, okay? And even the name is misleading because there is no brace on the planet that prevents rotation. So that's why it actually really bothers me that they call it a derotation brace, okay? So these are our functional knee braces. Like I said, most people returning from ACL surgeries, if their doctors recommend or tell you to go into braces, this is what they do. This is also what we put all of our linemen in. So we have a deal set up with Greg, and I couldn't tell you the specifics of it, but all of our linemen get measured and they get individual knee braces for the year. We do keep them on hand so that if we get new ones for our starting linemen, we do have hand-me-downs that we will give to our freshmen that are coming in. These can be custom or over-the-counter. Pretty sure the majority that we get are over-the-counter to fit more sizes, like I said, if we end up handing down type of things. But we can do a custom ACL braces, that are custom functional braces, okay? They have a unique strapping system too, so you'll see like these all have numbers on them to help prevent which movements we are trying to do. So primarily, we're preventing this tibia from translating anterior, right? Because it's predominantly for an ACL tear, but with the hinges on the side, it's also trying to protect our ACL, or sorry, our MCL and LCL too. So we have a numbering systems on the sides to try and prevent anterior translation of the tibia and posterior translation of our femur. Okay. So like I said, these most of our hinge braces are bilateral, so you can put them on either knee. Functional braces are either right or left. Okay, as you can kind of see the different functions, how they form, how they fit, how they contour through the legs, and our strapping system with it. Okay, so these are always unilateral. The next one is knee immobilizer. I want to make sure this is true immobilizer. Okay, so this is a true knee immobilizer. I would never put any of my athletes in this. This is something where, oh my gosh, I think I broke something in my knee, or I go to the ER because I don't know what's going on. If you have some type of knee injury, this is what they're going to send you home in. Because it's cheap, it's flimsy. Just like when I talked about the air cast with the ankle, that's what the hospital sends you home in. This is more likely what an ER is going to send you in or home in. The next one that we talk about is a post-surgical brace, and I'll kind of go back and forth between these two. So the book calls this a post-surgical brace. This can also be utilized as a knee immobilizer and also called a long hinged brace. Okay, so we still have our locked out. Okay, so knee immobilizer. So as you can see, we've got a dial on here for all of our angles. I can lock you out and prevent any bending, which creates and makes it a knee immobilizer, right? Then I can unlock you and I can choose my degree that I'm going to allow you to bend. Unlock it, so then I can bend it. This guy is set at 90 degrees. Okay, so I'm only going to allow you to go 90 degrees, or I can set it up at 0. Or I can set it and give you complete full range of motion. So we put these as post-surgical knee braces for someone that has, no matter what kind of injury they have, whether it's ACL, MCL, whatever it is, because we want to control what degree of flexion you are putting it in. So usually immediately out of surgery, we're locking you out, obviously depending on the surgery. As you progress in physical therapy, able to get your motion back, then we start allowing you to open back up again, okay? So, which is different from our true knee immobilizer, because there is no dial on there. We cannot control, we can't open you up. Obviously this guy doesn't bend, it bends the wrong way because they're cheap and flimsy, so it doesn't give true MCL, LCL protection. So you can't flex and extend your knee. Okay, the same thing when we fit this though. Make sure our knee opening is in the middle so you can see your patella, and strap them back up. More likely you're sitting at home with crutches anyways with this guy. When we are fitting a knee motion control brace or long hinge brace, our hinges, obviously same thing, going along with our joint line. If we have a taller athlete, since these are a long hinged brace, see if I can get them, can extend. Okay, I think I got 2. So I can move each one of these up and down, And then I can move these up and down too. So if I have a taller individual, I can slide these down. So there's a true long hinge brace. Okay, that makes sense. And then like you can control, open, close, whatever it is. I brought a few of these so you guys can grab them. I have two newer, nicer ones, and I do have one a little bit older. Like I said, these are actually really nice. Where it's just got the push button to move your angles and degrees. Some of the older ones, you have to actually pop off a lid or pop off a cap. They got metal pieces in there that you have to pull out and then stick whichever direction. So they've become super nicer, where it's just a push button where you can sit and move your degrees that you want to set on that. Cool. Questions about braces? Yeah.
So do you want that like as long as you can, like one of the long hinge ones? Do you want to put that as long as you can, just like above the malleolus, like that, if you even reach that part?
Just not really. You don't want it sitting down at the foot.
Yeah.
You still want it probably about mid shin, maybe a little bit longer, and obviously mid thigh. So someone taller, you're going to open it up, but you don't want it just sitting like a hinge brace, like our short ones. You're going to want it probably mid shin to mid thigh. Yep. Cool. So like I said, we will never ever use these or put an athlete in it. If I have an acute injury, I'm suspecting so-and-so went down with an ACL injury, I'm going to pull this guy out, put her in this brace, throw her on crutches, put it at 0, and send her to our orthopedic doctor. And then, so she's going to stay in this up until surgery, and then even for a couple months post-surgery, she's going to stay in this brace. Okay. Like I said, this is only going to happen if you're sending someone to the ER for whatever. And they're like, yeah, we kind of suspect you have an ACL tear. Put this brace on and go follow up with such and such orthopedic. We keep them just for show, or athletes have gone to the ER and we're like, we're taking this and we're going to put you in one of these. Okay. So yeah, you will never see one of us putting an athlete in that type of brace. Cool? Okay. So lots of time to sit, grab a brace, a couple different braces. Like I said, not all of them will fit everybody. I got to try and rotate these guys around so you can play with fitting them, playing with the hinges, limiting range of motion, adding range of motion, those kind of things. Cool? So you can kind of rotate things around. Practice putting on patellar strap. Like I said, I only have 2 actual straps. Otherwise,